Hey, this is Doug Field along with my co-host Brent Macy, and welcome back to the final segment of Healthcare Consumerism Radio. We're actually very pleased today to have a fellow Atlanta native here with us in the studio, Dr. Alan Spiro, who is Executive Vice President and Chief Medical Officer with Accolade, is joining us today. Alan, good morning.
Good morning.
Nice to have you here.
Great to be here.
You know, you got. I'd like you to kind of give a little bit background on Accolade. I think you're in a very interesting, fast-growing piece of this space, very much needed part of this space where the evolution of health advocates, or as you call them, personal health assistants. So tell us a little bit about what you guys are doing and the uniqueness of what you're doing in the space.
Well, we actually got started about 6.5, 7 years ago, and we started with consumer research. And rather than healthcare research, if I can put it that way.
Interesting.
And we did a lot of both quantitative and qualitative research about what people want. One of the reasons that our assistants are called assistants rather than advocates is when we asked people what they wanted, they said, we want help through a difficult system. We also found that they wanted someone they could trust, and that a lot of the solutions that were out there were based on reaching out to people when they were sick, which is not the way to build trust. So we built a service, which is your own family's Accolade Health Assistant, that you get to know before you're sick. And once you are sick, there's this natural tendency to then reach out to that person and really lean on them as you make your own decisions. So we're not, rather than advocate, we help people advocate for themselves. We're helping give people their own voice and empower them, not only when they're healthy and trying to stay healthy, but when they are within the healthcare system and floundering and trying to find their way in a very, very difficult system.
So you create that comfort zone of that family knowing there is somebody there to use your term, assist them and help them navigate this whole what can be a real mess. I mean, this whole mess.
Yes, especially when you think of it as two systems. You sit here as all experts in almost health policy and benefits. Well, the benefit system is one system, but the care delivery system is another system. Obviously, they interact, and you need help through both. When you're sick or a family member is sick, you're not making that distinction. You're really not.
Is there a target size of company that best fits your model?
For the most part, we look to larger companies because one of the things that we try to do is we try to partner with them and dedicate people to their population. And we're very aggressive about both the kind of people and the number of people we have. Our health assistants, and we believe that we are starting a new profession, the profession of health assistant. And these people come to us with very strong backgrounds as nurses, as social workers, as people with tremendous communication and problem-solving skills. We train them to be health assistants. And there's about one health assistant for every 500 to 700 families, which is means that for a large company, we have a critical mass of health assistants that are there to help their employees and their employees' families.
Now, the market should not be confused that you're not really a wellness company.
No.
You're not really a benefit solution provider. You are there as personal assistants personal health assistants for the individuals and their families.
Right, and their personal issues might be related to better health. It might be related to improving their diet and nutrition, and some of our health assistants are dietitians. It might be related to improving their activity and exercise levels, and we have exercise physiologists as health assistants. So we have all those specialty expertise in-house. It might be related to managing their diabetes, and we have diabetes educators and nurses. So when you define it as such and get away from the idea of a program and get more towards helping people with their daily lives, which is not about a program. It's about helping them change and manage their personal lives beyond healthcare.
You know, we talk about here at the Institute for Healthcare Consumerism, you know, our mission is really to not just be that collective voice on healthcare consumerism, but to really help employers and those working with employers, you know, engage their employees and their families to become better consumers of health and healthcare.
Yes.
And healthcare being the choices of the major medical, supplemental health, and those buying decisions they make in health. And your there as an assistant to help them become better consumers of health.
Yes, and actually one of the side benefits for those large employers is it is really appreciated. For those listeners who are familiar with Net Promoter Scores, our Net Promoter Scores are in the 70s, which is about the same as Google and Apple. When you look at the numbers for health plans, for example, which are at best in the around 10 to the teens, people love our service and they appreciate their employer for making it available.
Now, Alan, can you work with TPAs? Can you work with health plans as kind of a delivery system?
As a young company, we are now starting. We do integrate with health plans right now.
Okay.
And we integrate with TPAs right now. As a young company, we're also beginning to work together with and partner with health plans, and we'll have something probably announced by the end of the year.
Okay. Now I can kind of see, kind of looking at your solution. What about the connection point to the traditional wellness companies? Is that an evolution of the business model?
We actually do connect with traditional wellness companies when a large employer wants that.
Okay.
Or we provide those services ourselves.
Okay.
When you there's a lot of talk about the exchanges, not just the public exchanges, but we spend a lot of time talking about the private exchanges and the evolution of defined contribution. And there's a lot of belief that at the end of this upcoming open enrollment season, if exchanges work, and we know some aren't going to, and many will, but if, let's say they work and the defined contribution model works, that it's going to take off and there's really going to be quite an adoption into the 2015 plan year. What's your working position with companies that are looking to execute a defined contribution and private exchange model?
We think it just increases the need to have a health assistant. It's as simple as that, and I can't put it any more simple. It's elegant in its design, the exchanges, and for the average person is more confusing and more difficult to traverse. And one more reason to have your personal health assistant.
Well, let me follow up quick. I mean, that's natural that I was assuming you were going to say exactly what you said. But does that mean your teams are going to be also evolving into helping the individuals make the right decisions within exchanges?
We do that now.
Okay,
so right
you
now,
do. Okay.
And I won't say within exchanges, but for many large employers, for example, during open enrollment, people have a choice between different types of plans, and they'll call their personal health assistant who will walk them through helping them understand their options and understand what their choices mean for them as individuals, not just in general, but for their own personal and family status.
So you are actually there engaged with them as that trusted advisor in their health care and health decisions.
Correct.
Okay.
In both benefit type decisions and care delivery decisions.
Okay, very good. I mean, I applaud you on your model. I see a big need for it, and particularly with not only the evolution of exchanges, but the evolution of full replacement HSA programs. I mean, people talk a lot about exchanges, but outside exchanges, you're seeing a fast adoption of, high deductible HSA plans. And the smart employers are looking to surround them with tools and services like yours because they know that's important to take care of their people and to keep their people.
Absolutely. What you're really talking about, you almost have to get back to from what I'll call labor economics point of view. Why do people give health benefits?
Right.
It's to attract and retain workers as much as anything else and to keep people productive on the job and happy because they're more productive if they're happy. And we do a tremendous amount of work in accomplishing just that.
Alan, kind of give us a feel for, how do your personal health assistants engage and build trust in the people that you're going to be working with? We first talk to people, 2/3 of the time we're talking to people before they ever enter the healthcare system, before they're even thinking about healthcare. And 88% of the relationships we form, which is what we look at, are formed by people calling us. And they call us because we do replace the number on the back of the insurance card. We're the only number on instead of the health plan numbers.
Very good.
So when someone calls and says something like, I need a new card, I lost my insurance card, a good health plan will say, of course, we're happy to help you with that. What we do is we say, we're happy to help you with that. We can take care of it, but is everything okay?
Yeah.
What do you need a card for? I mean, is someone sick? Because I can also call your doctor's office. And by the way, I am your personal health assistant. Here's my direct dial number. If you go onto the website, you'll see a picture of me. And I'm here for you for anything you need from now on.
You know, we talk a lot, Doctor, about part of this big footprint of healthcare consumers is the evolving and change in the patient-provider relationships.
Yes.
So what part do you play there?
We facilitate. So we've got a fragmented system.
Yep.
And it's a fragmented system that is often very difficult, especially for people who have sickness in their family. And to help not just the patients but doctors through that system. We had one case in rural Illinois, which was a gentleman who had bad diabetes that was getting worse. His primary care doctor wanted actually to get him to a tertiary care center. We helped that primary care doctor and patient and got him there, got all the records together, did all that legwork, and it turned out that it was an adrenal tumor that could not have been handled in that rural area. We see this kinds of thing every single day. And it goes from that kind of complex issue to an issue of a gentleman who had congestive heart failure who the doctor was trying to say, you need to be hospitalized. We got on the phone, and since we really knew him, we found out the reason he was refusing to go to the hospital is he had no one to feed his cats.
Huh. Wow.
We found somebody to feed his cats.
Wow.
And he went to the hospital and was okay.
Those are good stories, and time flies when we're having fun here on the program. We got about a minute and a half to go, and I want to give you a real good chance to kind of wrap this up and leave our audience with some takeaways around what you do, Accolade, and what you do.
Sure. And what we do, you have to remember that it's always about people, not diseases, and not consumers, really. It's about people. It's not about programs, which are by definition limited. They're boxed in. It's about changing everyday life, and it's about making everyday decisions and good healthcare decisions. It's not an app or an incentive. It's about a person's values, their ability to make good decisions for themselves. And at Accolade, we've really proved that a trusted assistant who can help a person with their own actions based on their own values saves money, improves quality care, and it delights people.
Excellent. Well, Doctor, really, I appreciate you having you with us today. Very interesting discussion about what you're doing. To our audience, you enjoy your Labor Day weekend, and we will see you again next Friday on Healthcare Consumerism Radio.